In healthcare, every second counts, and having a supply chain that you can rely on to ensure that you've got the right products available when you need them is absolutely critical to ensure that clinical activity happens in a hospital. The cost of consumables in the NHS is significant, and therefore managing the stock in an efficient way is important. Too often, clinicians are faced with missing items that are not available for the procedures that they've scheduled. They spend valuable time searching for these items and also trying to understand whether that item has arrived, is in their storeroom, or isn't even in the hospital. And therefore, they waste time having to cancel procedures, but also having to reschedule those procedures, and this has a real direct impact on patient care.
As we're moving supplies around an entire health system, there are lots of different workflows to follow. It's important to make sure you have the right compliance and procedures in place so that you're never running out of the supplies that are critically needed for patients at critical times, such as in theater rooms or in general intensive care units.
Using the ideal balance of automated dispensing cabinets and manual hand scanners, KFM are able to see in real time all the stock across the entire hospital, whether it's at the back door or in theatre, based on the principles of ensuring the right product is in the right place at the right time. Working to GS1 standards, every single product and item is tracked from the back door right up to the point of consumption with the patient. Fully integrated with Oracle Health Purchase to Pay system and Epic and the theatre management system, is designed to ensure most clinical time is released back to the patient and that patient safety is paramount, ensuring things like never events, cancellations of lists and procedures and wrong site surgery are avoided. By simply pressing a button or scanning the barcode on an item, every single item and product is tracked.
So in our time, Omnicell has implemented hundreds of solutions across many NHS hospitals and trusts. And the difference between a successful system and a brilliant system is really in the team that run and are behind using and maintaining and the system administration of the system. And this is where KFM really come into their own, because they have a team who understand supply chain, are totally dedicated and focused to procurement and materials management. And their team are diligent and review the data in order to take the benefits from the solution, altering par levels, discussing with clinicians about alternative products, and really making the most of the data that we're generating with the Omnicell systems.
Being able to know what stock to increase, what stock to reduce, being able to track trends, seasonal variations, fluctuations and challenges in the supply chain, and knowing what's available and when is key to putting the patient at the heart of the entire solution.
So the work that KFM, Omnicell have been doing with the hospital has been really important. We run lots of theatres here, lots of complex operations. It's really important for us that we don't cancel patients on the day, that we've got equipment available when we need it, we've got the right products at the right time for the patient. So delaying surgery, cancelling surgery is the utmost thing that we're trying to avoid. It's been really good, the Omnicell project with KFM, that we've been able to streamline our inventory as well, so that we're not holding unnecessary stock in the theatre environment, cluttering up the theatres. We don't waste stock because we manage our inventory properly. And the other thing is, if we need to trace products, which products have been into which patient in the chance of a recall, or we need to just track some products, we're able to do that effectively.
We're really proud here at King's that we have 95% compliance through the systems that we use, over 500 Omnicell cabinets, and that's a really significant achievement.
And through this partnership, we've also been able to save £10 million annually through cost efficiencies, labour efficiencies, and cost savings.
And this has really been through management of the stock. So understanding what stock is available within the cabinets, understanding the value of that stock, and being able to manage that. And part of that is even thinking around some of the future upgrades and the real use of technology and AI in this space.
That's right. In fact, we've been able to manage over 250,000 lines of stock with a lean team, which also helps with the cost savings.
AI always seems to be the buzzword, but here it's where we can see it's making a real difference. And in the NHS, we're really embracing it. And yes, specifically at King's College Hospital, we are absolutely looking at how we can take on some of the upgrades and the innovation that is being rolled out by Omnicell and embed it and be the leader here in the UK for Omnicell.
It's been a fabulous experience, and we cannot wait to see where this goes next.
Absolutely.